My name is Amanda Harris. Student ID is 2965277. This is my AVMA video for surgery and anesthesia assisting. When a new client or patient comes into the clinic, we have them fill out this admissions form. Owner information, address, phone number, and then pet information. Name, breed, species, color, whether it's neutered or spayed, if they've been to any other veterinarian, up to date on vaccinations, records, why they've come in today, and then we have them sign and date it at the bottom. Once the patient is in our system, which is all electronic, their information is put into the file along with the animal's name, age, color, its weight and sex, and whether it's been fixed or not. Here you can see a full summary of their history within the clinic, any medications that have been prescribed, medical notes, vaccination history, and weights and temperatures. When a patient comes in to be examined by a doctor, we'll pull up a check-in. Why the patient is going to be staying, and then if there's any other additional information, such as if it was here for a wellness, we would put vaccinations here, or if it was sick. Let's say the patient wants to be seen for storm anxiety. We would put that there. And then we'll check in. Once we have it checked in, it will print us off a piece of paper that has all the owner's name and information, pet's name, and signalments such as breed, weight, age, and then any additional diagnostics that had been done in the past so that you can go into the clipboard and review them. Anytime a patient's going to be boarded with us or have surgery, or if it's come in to be euthanized, we'll need a release form signed. That's also electronic, so we would pull up a correspondence and then type in whatever type of form we're looking for. So, euthanasia form, giving us permission to euthanize the animal. Anesthesia, feline, dental, or canine anesthesia forms. We also offer exotic care here, so we have an exotic form as well. Boarding forms. If the patient's going to be boarded with us, we go over what's going to be eating and any bedding or food that's been brought in, and if the patient is on any medication. If a patient's going to be surrendered by the owner, we also have an agreement of pet transfer ownership, so that we have on file that they have given us permission to take over ownership of that animal. Patient is going to be staying in the hospital or for surgery. We need to print off identification cards for the cages so that we keep the patients in order and medications given to the right animal. That's also under the correspondence. So it pulls up with the animal's name, owner's name, client ID, and when they were checked in, their current weight. And then we would type in why they're staying, whether it's a dental for surgery, or if it's being hospitalized, let's say hit by car, we would put that, and then we would print it. Once printed, we'll put it on an index card, and then we'll put it in a slot on the cage that the patient's going to be staying in. We have a couple different types of laboratory forms depending on where we're sending and what we're sending out. A lot of our fine needle aspirates or impression smears, blood smears go to cytovet. So there's this form, and once we've gotten the results back, they're emailed to us and we attach them to the patient's file just through a medical note. Occasionally we'll send out to the A&M veterinary laboratory. Same process, they email us the results and we'll attach them to the file. If we're sending something to IDEX, it's automatically put into the file through our Vet Connect Plus on the Cornerstone site. As you can see here, we sent off a total T4 thyroid panel on this patient, and the results were automatically put in for us to view. Here's an example of the cytovet. So like I said, it's attached to a medical note. We'll pull it up and view the results. I'll be using a past dental that was done on my dog as an example of our anesthesia form and how it needs to be filled out. Also electronic based when we have them sign on a pad. So at the top, as you can see, owner's information and pet's information, phone numbers that can be called after the animal's woken up or during surgery. The procedure being done is a dental here. If it was a spay or a neuter, you would just change that. Blood work that would need to be done, and if the owner declines it, we make note of that. The animal's on heartworm prevention, and if they haven't, we require a heartworm test. Any type of seizure activity to be known. On dentals, we like to know the status of ticks within the last year. And then a little description about whether we will need to call them if there's any extractions that need to be done or dental radiographs. If we're removing a growth that we are concerned about, we ask if they'd like to send it off for histopath so we can check yes or no there. And then if there's anything else that the owner would like done while the animal is sedated. So the owner signs this and it just gives us permission to sedate their animal under anesthesia. When the animal is discharged, we send the owner home with a go home or discharge instructions. If there's any medications that the animal is going home on, we will put them here in the instructions and then go over them on the label on the actual medication as well. If there's any change in diet, such as needing to be fed soft food, or after a certain amount of time after surgery, we'll note that here. If there's any restrictions, if we've done like an orthopedic surgery, we will note that under the exercise. And then on the surgical instructions, we just go over with the owners that there could be some vomiting, diarrhea, lethargy after being under anesthesia. I'll be demonstrating how to properly restrain a patient for blood draws. If we're drawing from the jugular vein, the technician will hold behind the patient and lift the head up as if we're in a howling position. If we're going to be drawing from a cephalic vein, you'll hold the leg out and hold off or occlude the vein. So, for a saphenous blood draw, you'll extend the rear limb and hold off the vein like so. You can see the vein right there. To properly remove a patient from a kennel, we're going to have our slip lead. Properly put a patient in the kennel. We'll put them in the kennel. Have your door ready to be shut. Remove the slip lead. To safely place a muzzle on an animal, you'll approach them from behind. Place the muzzle. And clip it. We've got our Elizabethan collar made up. You can either use brown gauze to tie it or you can use the collar, but we've found that at times the collar doesn't really work because the dog's able to get the collar off easily. We'll place the e-collar over the head. Like so. And then you'll tie this tight enough to where they can't get the collar off, but not too tight to where we feel like it's choking them. Begin our physical exam. First, we're going to check the temperature. I always like to look at the temperature probe, make sure that everything on there is normal, the material. Our temperature is 101.8, so that was normal. Next we're going to feel our pulses. And we will count the 15 seconds. Okay, good. Okay. Looks like our pulse is about 90. Now we're going to listen to the heart and the lung fields. A little difficult with his panting. Alright. Next we'll look over the entire animal for the physical exam. Checking the eyes. Ears. Mucous membranes. And checking hydration. Capillary refill time. Teeth. Throat. Your coat looks good. Body condition is good. Forming a cephalic blood draw on this dog today. Okay. I will be drawing blood from a jugular vein today. We're going to disinfect the site with alcohol. We're going to be drawing blood from a saphenous vein. The handler is going to occlude the vein by holding off. Bevel up. Easy. Oh, easy bird. Easy. We're going to be doing a cephalic blood draw on a cat today. We're going to disinfect the site with alcohol. And there we have it. We're going to be doing a jugular blood draw on this cat. We need to disinfect the site with alcohol. Good girl. There we have it. We're going to be performing a saphenous blood draw, a medial saphenous blood draw on this cat. We're going to clean the site with alcohol. And there we have it. So we're going to be discussing the minimum database or minimal diagnostics required for a patient to go under anesthesia. That includes a packed cell volume, total protein, glucose, creatinine, and ALT. In my clinic, we kind of break it down on a patient's age and the surgery that we are going to be performing. A patient that is young, healthy, and undergoing a routine surgery such as a spay or neuter would be required to have a 2 test, which includes that BUN and ALT. For patients that are middle-aged, 4 to 8, and going under routine surgeries, we require a 10 test that includes multiple of those aspects deeper into the liver and kidney values, includes the glucose, TP, globulin. Patients that are in the geriatric age or young patients that are undergoing a more in-depth surgery, such as an exploratory, or pyometra, we would require a 17 test that goes even deeper into the organ function. If any of these tests were to come back abnormal, we perform additional diagnostics such as radiographs, ultrasound, ECGs before surgery starts. Proper pre-anesthetic protocol is always based on the patient's age, surgery that we're undergoing, whether it's painful or routine. There's multiple pre-anesthetics that are used in my clinic. A few of the more common ones that we like to use are hydromorphone as a pain reliever before and after. We use Torb injection. Primarily the older doctor uses that. On felines, Cimbidol is a very routine one that we use. Covers good pain management. Midazolam is a regular one that we use. And of course, buprenorphine for pain management is very common in my clinic. We also have dexdomitor that helps sedate the patient quicker, and of course antecedent that brings the patient out of the sedated field. To fill out controlled drugs when we're using them, we of course fill out the date, the medication or pre-anesthetic that is being used, and the bottle number, the amount used from the bottle, the patient's first and last name, and then the technician that drew from that bottle. Alright? So we'll just do a mock one here. We'll say today is 9:30. We drew from buprenorphine, bottle number 51, in negative 0.5. We'll put my dog Murdoch. And my initials. And if there's any issues with the controlled drug lot numbers or inventory, we're able to go back and see which technician, and if we need to address them, see if something was a mistake, if they put it in wrong or used the wrong lot number, we know who to ask. So here we have our anesthesia machines. We have two in my clinic, one for the surgery ward, which includes the ISO and the sevoflurane. And then we have our much easier movable that only has the isoflurane for when we're inducing our patient in the pre-surgery ward. So we have on both of them the amount of anesthesia that is being administered to the patient, and then of course on the Sevo the amount of anesthesia that's also being administered. Our oxygen gauges, here, the pressure, open and closing valves. We've got our chambers here, and when they were last changed. It also has the meter on color, so of course if you forget or know when to change the Sotasorb, it's indicated there. There's two different types of systems. We've got our rebreather, which is a closed system, and our open system, non-rebreather here. You of course can change from closed to open on the non-rebreather. So when it's closed, the patient is going to be more sedated than when we have it open, because they're breathing that gas back in instead of it being interchanged. We've got our scavenging system that goes out of the building there. And of course our oxygen as well, from where it's coming from, which is our oxygen tanks are kept in a different room. The induction process, we've got multiple sized masks that can be used to induce with gas. For fractious cats, we of course have our anesthesia box, which we would hook up with a non-rebreather. And those are our anesthesia machines. We're going to be performing a leak test on our anesthesia machine. So we've got our rebreather on, our reservoir bag, our oxygen line set up. Alright, so we're going to close our valve completely. We're going to push our flush valve until the reservoir bag fills up completely, and it should stay at the 30 mark. If it does not, then we have a leak. So as you can see, it's staying there. Alright, now we're going to open our relief valve, and all the oxygen should leave. Now it's back down to 0, so we picking up our leads. We're going to start with the ECG, which measures pulse wave and formation. Indicators are on the clamps for which leg they go on. Then we'll wet it down with alcohol. And then our pulse oximeter, or SpO2, we'll put on the tongue, and that measures the amount of oxygenated blood and pulse rate. And then our blood pressure monitor, which of course measures the blood pressure. Like so. We've got our esophageal stethoscope here, which will go into the mouth. So, and then of course we need to take the temperature. Temperature should be checked frequently throughout surgery to make sure that the temperature is being maintained. Like so. Alright. So we've got our breathing monitor, ECG, blood pressure, our thermometer, and then our monitor that is reading all of our vitals. If we were going to be performing a surgery such as a GDV, we would need to do a gastric intubation. We're of course just going to be demonstrating on this dog. So we've got our gastric tubes here, and we would measure from where the stomach is to the outlet of the mouth. We'd make a mark, and we would then lube the tube and insert it until we reach the stomach to be able to either release air or pump it. So when measuring for an endotracheal tube, we want to measure from the tip of the mouth to the thoracic inlet. I'm going to be introducing my preceptor here.
Hi, I'm Stephanie Reed. I'm an LVT, and I got my degree from Cedar Valley College.
All right. I'll be placing a cephalic catheter in this dog. I've got my sterile field with my T-port, my flush, my catheter, clippers, chlorhexidine scrub, and alcohol. We're going to make our tape.
They'll probably do a little deeper, and I need to call her. I'm just gonna run it over. I gotta get
Slight
right where you
indent
are.
in this one.
Just stop in the wrong spot.
And we're going to split this one in half. Take our clippers and put the hair from where we're going to place the catheter. Another cap. We'll scrub the skin 3 times, alternating between the chlorhexidine scrub and alcohol in a circular motion.
I did get the results back on one of the tests that I sent. So, hard to get a chance. She still hasn't evaluated it. But, we've got her. So that's all.
Open our catheter. Remove the end.
Let's go see Frank. Hey, how are you?
T-port.
So we just need to,
Flush it. So that we have both of those ready to go.
Harlow needs to get cleaned up for me, okay?
Okay.
And we gotta keep, she's really.
Let me zoom it on. Blood. Release our tourniquet. Okay, our catheter is in place. We'll take one of the splitted strips of tape. And then we will take a piece of tape that has the split in it. And tape it under the catheter. And we're going to place our T-port on the catheter. We'll flush it to make sure that it's patent. And then we will tape the T-port down. Last step is we're going to bandage our catheter.
He can walk. She's been sleeping on the floor.
We use red for our
He's just kind of wobbly when he tries to walk.
patent catheters,
Yeah.
and then we'll switch it to green once we've removed the catheter. Okay. Alright, we're going to be placing a saphenous catheter today in this dog before her spay. We're going to clip the site. Okay, we've got our catheter, our flushed T-port, our chlorhexidine scrub, and our alcohol. We'll remove the end piece and set it aside. We're going to scrub the site that will place the catheter 3 times in a circular motion. Each time with chlorhexidine and then followed with the alcohol. Take our catheter with the bevel end up. You see the flash. Release the catheter and take our cap.
And it just died.
Alright, and the next piece is the one that we've got the tear in. We're going to place our T-port on now. Make sure that it's patent. Tape down our T-port. and saphenous catheter. Performing the sub-Q injection, so we're going to be doing this just under the skin. We'll tint the skin, insert the needle, draw back, and inject our Cytopoint. Alright, today we're going to be pre-medding this dog for a neuter with an IM injection of buprenorphine and dextromethorphan. We pull back on the syringe to make sure that we're not in a blood vessel. We're going to be doing an IV injection on this dog. First to clean the site with alcohol. And then something. Okay. In our induction process, we're going to use propofol as our inducing agent. We'll only inject a small amount at a time and assess the sedation of the patient. It said like about 5, right?
We'll keep going. So I drew it more. Come on. Get the light.
All right.
Okay. And then we're going to tie behind the canine teeth. We've chosen our intubation tube based on the dog's weight, which is about 50 pounds. So we've chosen a 10-sized intubation tube. We're going to check to make sure that there's no leak by inflating the cuff.
It's a good show.
Alright, so the cuff inflated as normal. We also measure the intubation tube by the dog sitting or laying sternally. The tube should come out of the mouth just slightly. So, as you can see, it will be a perfect intubation tube. Alright, now we're going to hook our patient up to anesthesia.
She's got to do that. Come on.
And we're going to cuff our intubation tube that we checked prior.
Move the light out of the way. It's just too bright right there.
Making sure that we don't overcuff it as well, so you'll apply pressure. And the cuff should be still helpful. We're going to express the bladder for this spay. Okay, we're going to begin our clip, and we'll follow with the scrub. Alright, now we're going to begin our scrub in a circular motion, alternating between the chlorhexidine scrub and alcohol. I'm going to scrub the site 3 times, and then once more once we've moved the patient into the surgery ward. Alright, now we're going to move the patient. We gotta hook this up, show us.
pass on that side if you need it. Not in time, but I can screw it in. Yeah, the little knob on the end. There you go, and then screw it back down. And that'll hold it in place. Yep.
Go in the closet. I'll turn them off. Alright, we're going to do our final scrub now that we have the patient hooked up and tied down. Alright.
Okay.
Throughout surgery, we're going to be writing down our parameters of the blood pressure, beats per minute, pulse rate, and SpO2. So the time is 240. O2 is 96. Heart rate is 23. Alright, we're going to check it again in a couple minutes. Alright, we're checking our parameters again. It's been 5 minutes. Beats per minute is 124. Blood pressure is 62. SpO2 is 97. And we are at 1 liter per minute of oxygen, and our anesthesia is on 3. We're going to be demonstrating how to perform CPR. I'll first talk about how we would use an AVMA bag if we had one. We usually just intubate the patient and put them on a vane. But if we had the mask, we would place it over the muzzle and then give 2 breaths after every 100 compressions. So to do CPR, we would place our hands behind the arm right at shoulder blade length, like so, and we would do 100 compressions per minute. We're going to scrub in for surgery.
Where are the technicians? It's you? You got 4 people. Are you it, technician wise? Everything's ordering. Dallas?
I don't need that, I'm good.
You're good.
Just making sure that you're in.
We're going to dry
You.
from fingertip to elbow.
Yeah, that's right.
Hey, honey. This is what I found, I think.
Yeah, that's fine. Push this, make sure it's
sure you don't push it.
It is.
Now we're gonna glove up. Appreciate it. She was in heat not too long ago. She shouldn't still be in it.
She just got some dry blood back there, so maybe she's had to clean herself.
Gotcha. We're going to be preparing the surgical ward for our canine spay today. We're going to set up our surgery pack for the doctor, making sure that we keep the pack sterile.
There's stitches underneath that'll dissolve on the skin. On the black and has a couple extras outside, but those dissolve as well. Okay, you're welcome. We'll see you after 4 o'clock. Yep, there you go.
We'll be opening some lap pads to demonstrate how to protect organs. We're going to place the scalpel blade on the sterile field for the doctor, and then we'll load it into the handle when we're sterile. Alright, we're going to drape our patient now. We're going to blot excess bleeding for the doctor. Okay. We're going to be placing some lap pads down to keep exposed tissues moist. And the circulating nurse is going to apply the sodium chloride, 9%.
Let's put one on this side first.
So I'm going to be demonstrating how to apply a scalpel blade to the scalpel handle and remove it. So we want to pick up the scalpel blade with some form of forceps so that we can clamp down on the handle. We would like the scalpel blade with the indent up. We're going to slide it into the grooves that are on each side of the scalpel blade handle head. Like so. And then to remove the scalpel blade, we're going to pick up the blade at the bottom part and then just slide it right back off.
Outlets, please, ma'am. Two more. And I need a scalpel. And tissue forceps. Thanks.
The job of the sterile technician to always remain in a field of sterility, keeping our gloved hands at chest level, standing within the surgery field, being aware of surroundings. If a glove or gown were to become contaminated, we would step away from the sterile field, deglove or degown gown with the help of the circulating nurse, and then place ourselves back in the sterile field after we become fully sterile again. Same with the doctor. If the doctor were to become contaminated in any way, they would step away from the field, and either the sterile technician would deglove, degown, and assist them, or the circulating nurse would. Today we're performing a canine neuter. As you can see, we've got our vitals hooked up, our ECG, our SpO2, and our blood pressure. Today we will be performing a feline spay. As you can see, we have our surgical site clipped and prepped for the spay. Our patient's vitals are running, blood pressure, beats per minute, and SpO2. Today we're performing a feline neuter. We currently have our vital signs hooked up, reading our beats per minute, our SpO2, and our pulse rate, and our blood pressure. While our instruments are soaking in their water with the chlorhexidine, we're going to continue to clean up the surgery ward, picking up any towels or trash left behind from the surgery. And we're going to wipe everything down with trifectant. Okay, so to begin, we're going to start disinfecting all the surfaces in the surgery ward with a trifectant diluent and a clean rag. All surfaces are important as to avoid contaminating the next surgery. And we're going to lay down a fresh towel. We're going to mop the surgery suite. We've got a bleach water mop, and then we're going to dispose of the trash. And if there's any sharp objects, we of course need to put them in a sharp container so that it is all safe and secure. Need to move everything around when we're mopping so that we get under all the surfaces. This is of course after we swept, if there's any excess hair in the surgery suite that we need to pick up. And this is done. The mopping is done at the end of the day, and then of course the cleanup is after each surgery. Unless we had a surgery that was particularly dirty, then of course we want to clean the entire surgery suite before proceeding to the next one. Here we are at our sink. We're going to get our water going. We want warm water. We've got our chlorhexidine scrub that we're going to clean the utensils with. We've already removed the scalpel blade and any extra needles. So we're going to set our surgery pack here in the sink. Alright. We're going to let this soak. And then we will place our utensils into our ultrasonic cleaner. My clinic has an ultrasonic cleaner. Some clinics do not. In the book it just says to set out to dry and then we'll autoclave. But we're going to do that step as well to ensure all the utensils are clean. Our instruments are done soaking. We're going to start cleaning them. We've got our fresh sponge with bristles on the side here. That's what we're going to be cleaning with. Each instrument and into the autoclave, or sorry, into the ultrasonic cleaner. We're going to do this to every instrument, even the ones that weren't used. Making sure to get any blood splatter. So our ultrasonic cleaner has finished with our first pack. We're going to remove those and lay them out to dry. Alright, so here we have our towel that we're going to wrap our pack in. Clean towel. We're going to line our utensils up. Here we go. Towel clamps at the top. Alright, we're going to apply some Miltrax spray lube to our instruments right down the middle. Don't need a whole bunch. We're going to allow these to dry. We'll come back and we'll pack them and put them in the autoclave. Our utensils have dried. We're going to pack them up. Making sure that all the colored tape that my clinic uses to distinguish the different packs, we want to make sure they're all going the same direction to aid the doctors and the kennel staff to package them properly. And then we're going to place our forceps and our scalpel blade just underneath all the instruments so that they are secured in place. We're going to place some clean gauze in our pack. Extra needles. Alright, and we're going to begin wrapping. We want to make it tight as possible. We'll place a towel, clean towel in our pack. On the trifold, so that when we pick it up, it folds apart. An indicator strip to ensure that the autoclaving has cleaned it. In our spay packs, we also include the gown, like so. Alright, so we have our surgical drape here. We've included our utensils, gown, a towel, and of course the actual surgical drape. Alright, now we're going to begin folding. Alright, we're going to wrap our pack now. When we're wrapping it, we want to fold a piece over so that when the technician is unwrapping it, we can keep the inside of the pack sterile. Making sure that we keep this nice and tight. Again, folding over. When we fold this last piece, we want to leave a piece out so that we can pull it when we're ready to unpack. I'm going to place tape over the side, and when we are done with the autoclave, this is going to be scorched, and that's going to show us that it went through on the autoclave. Alright, you're going to be wrapping a gown for when a technician needs to sterilely glove in. Again, diamond form with just the gown and a towel to dry their hands. Again, in the trifold. There we go. And of course our indicator strip. Again, needing to be very tight. And then back over. Once more. And then on the last one, we're going to tuck in just as we would on the other packs. There we have it. We're going to apply tape and label it as a gown pack. Got our surgery pack here ready to go into the autoclave. Got a couple of other things over here that are also going to go in the autoclave. Want to make sure that we don't overcrowd it though, so this is a pretty large spay pack, so that's the only thing we're going to put it in for this one. We're going to flip it over. You can see here that the water was still full. We could fill it a little bit, but there's no need for this cycle. That we fill that probably after this cycle to where that line is there on the distilled water. On our autoclave machine, there's pouches and packs that can be ran. If it is a mixture between pouches and packs, we always select the packs button. If we need to flash sterilize something, we can do the unwrapped. We don't really need to do that too often. We have plenty of packs in this clinic. So we're going to select packs. And then we're going to press start. So it's filling the chamber now. It's going to start. So it's going to sterilize our packs through a heated steam system. There's also cold sterilization, but my clinic does not use that. The proper temperature of an autoclave should reach about 120 degrees Celsius. The pressure should reach 15 psi, and the cycle runs for 30 minutes. To maintain our autoclave, we would fill with distilled water right here in this little cup, and then it fills the tube. When it needs to be properly maintained and cleaned, we do send our autoclaves out to a proper facility. Needs to be filled after each cycle or each run. To ensure pack sterility, we would take the pack out. We would see that the tape's been branded. Upon unwrapping for the doctor, we would see that the strip that we inserted in the beginning is now marked stating that it was properly sterilized. We're going to be doing a suture removal today on this bay. Excuse me, a staple removal. This side's a little dirty, has some scabs on there, so we're going to clean it afterwards with some chlorhexidine.